Okay, on that note, we will go to our guest. Anandita, can you hear us?
I can hear you loud and clear. Can you hear
Great,
me?
thank you. Yes, we can. So Anandita is UNFPA's representative in Lebanon. I know she had to fly to Cairo yesterday, so you're in Cairo currently. But we look forward to hearing your updates about the situation in Lebanon. Thank you. Go ahead, and then we'll take some questions.
Thank you very much. Good afternoon, everyone. So I'm addressing you today, and it is a time of deep fear, uncertainty, and escalation in Lebanon. Despite the ceasefire that's in place, the hostilities have not stopped. People across Lebanon, particularly women and girls, are facing appalling levels of violence, displacement, and human loss. Just yesterday, the forced evacuation orders in Beirut and the intense attacks in southern Lebanon added to the vast scale and the level of uncertainty that is creating panic and distress. And it's pushing countless families to make very difficult decisions and choices in their search for safety. Just over the weekend, airstrikes damaged a UNFPA supported primary healthcare center and women and girls safe space in South Lebanon, one of the very few facilities that had continued to be operational and provide life saving support in that region. In another airstrike on southern Lebanon, there was damage to a public hospital that has maternal health services. It's one of 3 hospitals that provide these kind of services in southern Lebanon. Again, when maternity wards and hospitals are damaged and destroyed, it is pregnant women who cannot get life-saving services. There are 13,500 pregnant women among those displaced, 1,500 expected to give birth in the next 30 days. That means while we are sitting here today, 15 women may have gone into labor in situations of displacement across country in a very difficult situation. An estimated 1,500 women remain trapped in southern Lebanon without access to skilled care and safe delivery spaces. It is important to highlight that what we have now in Lebanon is a health and protection crisis. It is also increasingly a protracted crisis. Despite the ceasefire and the adoption of the World Health Assembly resolution on 21st May calling for the protection of healthcare in Lebanon, attacks have continued. Since the 2nd of March, according to WHO, there have been more than 190 attacks on healthcare that have resulted in the deaths of 128 healthcare workers and 332 injuries. These attacks shatter the continuum of care, and they also create fear among people. We are deeply worried that women and girls will not seek out life-saving services because they know that healthcare is under attack. Women and girls are also facing extremely high levels of gender-based violence. UNFPA and its partners recently conducted a safety audit in the shelters, and we found alarming protection risks: overcrowding, lack of privacy, lack of gender segregation, poor lighting, unsafe sanitation facilities. Female-headed households, adolescent girls, pregnant and lactating women, and persons with disabilities are among those most at risk. Women and girls are bearing the brunt of this crisis. UNFPA is working tirelessly with the government of Lebanon, with the UN system, local partners, and women-led organizations to deliver life-saving maternal and reproductive health and protection services. We have mobile medical units and teams on the ground in very difficult and hard-to-reach areas, providing maternal care, protection and health services, and psychosocial support. However, our ability to sustain this life-saving work is under severe threat. Stefan spoke about the flash appeal that's going to be launched this Friday. UNFPA's initial flash appeal for March to May 2026, aligned with the overall UN flash appeal, was only 30% funded. UNFPA will be launching an extended flash appeal in line with the rest of the UN system on Friday as well, bringing our total funding ask to $25 million USD for the response. It's a very modest but an extremely critical life-saving ask. Without this immediate and sustained funding, thousands of pregnant women will lose access to skilled birth attendants and services. Our mobile medical clinics will be forced to stop serving remote areas. Scaling down our operations means cutting off more than 75,000 women from critical gender-based violence protection, case management, and safe spaces at the exact moment that they need them most. My call to the international community is clear. From UNFPA, we have three asks. Echoing the Secretary General's call for a permanent end to hostilities, as well as a respect for international humanitarian law. The second is sustained funding for the humanitarian response, particularly critical and underfunded areas such as maternal and reproductive health, as well as prevention and response to gender-based violence. And third is preserving the health, safety, and dignity of the women and girls in Lebanon. Women and girls are not an afterthought. They must remain at the very heart of our collective humanitarian response. Thank you.
Thank you very much, Anandita. We'll now take some questions. Edie, please.
Thank you very much. On behalf of the United Nations Correspondents Association for doing this briefing, my name is Edith Lederer from the Associated Press. Two questions. First, can you give us some details about sexual violence? I mean, you talked about women and girls in shelters, but perhaps you have some more details or numbers. And secondly, you said the current appeal is 30% funded and that you're now hoping for $25 million. What is the current appeal? Thank you.
Go ahead, Anandita.
Thank you very much for the questions. To start with, on sexual violence, one of the things that we see in Lebanon, and this is the case for crises across the world, is that there's always an increase in gender-based violence in conditions of extreme vulnerability and conflict, like we're seeing in Lebanon. We do not publish details around our gender-based violence work. That data is available simply because that data is extremely we try to make sure it's anonymous and private because that's the nature of the work we're doing. It's extremely sensitive data. Having said that, we do know that gender-based violence is on the rise. One of the things UNFPA does is also bring in life-saving supplies into Lebanon, which includes supplies for the clinical management of rape. So this is part of our overall response to the humanitarian situation and the rise in gender-based violence that we're seeing. The second question around the current appeal. So in line with the UN system, which launched the initial appeal of $308 million from March till the end of May, UNFPA also had a flash appeal of a modest $12 million, which is less than 4% of the overall flash appeal. That is the one that was 30% funded. Now, in line with the rest of the UN system, we are also extending it till the end of August because what we are seeing is a protracted crisis. That overall ask is about $25 million.
Thank you so much, Anandita. This is Ephraim Kosaifi from Arab News Daily. You spoke about working tirelessly with the Lebanese government on this crisis. Can you give us more details about what actually government officials are doing to address this crisis? People who follow the news from Lebanon are under the impression that leaders are kind of sort of checked out. Some of them are on vacation, like they're not really stepping up to the occasion. Can you tell us what kind of a relationship you have with them and what exactly they're doing to address the crisis? Thank you.
Thank you. Go ahead.
Okay, thanks very much. So what is important to signal here is that the Lebanese government is leading and coordinating this response. For UNFPA, we work primarily with two line ministries, the Ministry of Social Affairs, that is the one that's tasked with coordinating the overall response, as well as the Ministry of Public Health that oversees the health response. We also play that very important liaison role between the government of Lebanon and our communities on the ground. So in response to your question, the government is leading the response, it's coordinating the response. Our role as the UN is ensuring that what we're hearing from the ground also informs the government response. We're also convening partners around health and protection so that we're making sure that at the same table we have government, women-led organizations, and NGO partners all speaking together. This is very important for continued and sustained national ownership and community-driven response to the humanitarian crisis.
Thank you. Islam?
Thank you very much. Islam Doğru from Anadolu Agency. Two questions. First question is that you are on the field in the crisis area. You deal with the people. What kind of reaction, appreciation, or criticism you get from the people, especially if the UN doing is enough? And second question is that do you only deal with the Lebanese governmental official? Also, do you have to deal time to time with non-governmental official? You mean, I mean who, you know who I mean. Thank you.
Thank you.
Should I go ahead and
Yes,
respond?
go ahead, Anandita, please.
Yeah, thank you very much. So for UNFPA, again, one of the things I would like to start with is that UNFPA works with local partners. So all our partners that we work with in Lebanon, besides the government, are local partners on the ground, half of whom are women-led organizations. This is very important to ground our work in the community. So in terms of the reaction we get when we go to the field, it is a positive reaction. It's one where people welcome the work that we're doing. We're seeing the efforts we're doing. We're also very, very people-centered. This is a human-centered response. I don't go and say, this is what UNFPA wants to deliver to you. I want to listen to what women and girls are telling us they need. That is what drives our response. So we go and we speak to people and say, what do you need from us? And we will try and make that happen. If it's not in UNFPA's mandate area, we take that message back to those who can do the work. So for example, when I go into a shelter, women will tell me we need, for example, supplies for our new baby. UNFPA can do that through our baby kits. Some of them will say, look, I have a friend or someone who's experiencing some kind of violence. We can get them treatment. If it's other kinds of needs around food or water, we then refer it to other partners. So the reaction from the people we serve has been largely welcoming and warm, but it's also because we are the ones listening to them and making sure that that is what's driving our response. In terms of who we work with, it's strictly with the government of Lebanon, as well as the governors that serve in the different districts we work in, as well as our local partners operating in the field. That is who we work with in Lebanon.
Thank you very much. I don't see any more questions in the room or online. Anandita, thank you so much for taking the time. I know you're squeezed between a lot of different things, but it's very important to hear from our agency colleagues in the field about what's going on. So thank you. We hope to see you back soon.
Thank you.